there's another population of people that could lose their health care. It's the people who are paying full freight for their own health care. We heard stories from people across the state. Because I give my personal cell phone out to hundreds of thousands of Oregonians, and guess what? They called me a lot. And we heard stories from people who are paying enough in their health insurance cost that even with this kind of reinsurance program, it's more than a mortgage payment. It's more than rent. We had a gal, super nice. She put $2 in the envelope with her 2 signatures and said, "I'd like to give you more, but my health care costs are $1,204 a month, and we're retired." Someone just put on our Facebook page today that their health care costs are going up to $1,900 a month for their family next year. That is not sustainable, and no amount of a reinsurance program, which we really didn't need anyway. That's a longer, more complicated story, but by not moving public employee lives into the health exchange in 2015 like we were supposed to, we lost the opportunity to level out the risk pool, bring down rates for everybody, and save the public treasury about $400 million a year by moving teachers into gold plans on the exchange. So, I was here in 2011 when we started to implement the ACA. I was on the healthcare committee that year. I voted for the coordinated care organizations. I grew up on Medicaid. This is not about taking away Medicaid. It's about making sure that other people don't lose their health care too. Because if it was such an important thing to do, why did our Democratic colleagues and the few pro-tax Republicans carve out insurance companies, carve out big corporations, carve out unions? None of those people are subject to this taxation. It's all individuals and mom and pops and college students and nonprofits and people who don't have a lobbyist. That's who's going to pay this tax. So they could lose their health care too. Nobody should lose their health care. We have money. If we rethink how we use our public health care resources, we can cover lots of people.